Welcome back to Connected by Health. This is your own podcast. And today we have the honor of having a wonderful guest today, Mr. Troy Green, who's a candidate for the United States Senate representing Oklahoma this year in 2026. Mr. Green brings more than 30 years of experience in law enforcement, juvenile services, private security, and community leadership. He's also the founder of an organization known as Safe Haven Oklahoma, a nonprofit focused on combating human trafficking and child exploitation, and has dedicated much of his career to serving at-risk youth and vulnerable communities. Raised through foster care and overcoming significant hardship, Mr. Green says his campaign is built, not bought, and centered on working families, public safety, education, and opportunity for all Oklahomans. Please join me in welcoming Senate candidate Mr. Troy Green. Mr. Green, thank you so much for being here today.
It's my pleasure. Thank you so much for having me.
All right. So, can you please tell us a little bit about yourself and why you're running to be the next Oklahoma senator?
Well, everything you said in the introduction, pretty much covers all of it, and all of that are the reasons that is the reasons I'm here because I've gotten to a stage in my life where I'm constantly looking backwards at my youth and the things that I've done and the things that I still want to do. And you start to wonder, what meaning your life has had, once you get my age. And so looking backwards, I've had a hard time finding the people who fought for the systems that are still broken today and who's fighting for those systems now. And sadly, this, is all connected into our political system, and I just couldn't find, the person that I feel is supporting and fighting for me personally and the things that I've come through, and those who are still fighting through these same struggles. So, uh, everything that I've looked at seems to have gotten worse instead of better, or most certainly has not improved, whether it's the foster care system, DHS, our healthcare system is crumbling. And again, I've always been a guy to lead by example, and I've always taught my children and my students to get involved. And so I finally decided it was time to put my money where my mouth is and
Mhm.
and and take the first step.
Well, thank you for doing that, and I really appreciate earlier when you said it's all connected, and it really is, and
Mhm.
that's
Yeah.
kind of the hope with this podcast is really to help people understand. There's a lot of things in society that really are just put together, and we're all connected by health.
Mhm.
And I really appreciate what you're doing. And speaking of healthcare, you have pledged to lower prescription drug costs and then protect and expand Medicare. What specific bills will you be championing to reduce drug prices and, of course, expand coverage? And the big plan, which is to ensure affordable access to specialist and mental health care here for Oklahomans.
So, I mean, first off, let me say that mental health and is healthcare, right?
Hmm.
So, we'll get to that in a minute, but I, back to prescription drugs. Uh, I'm fortunate enough that my wife has been a nurse for more than 20 years, and so I get to hear all of this from her directly. So I'm not guessing at some of these things, and she's in her master's program right now for executive nursing, and so
Oh, wow.
uh,
Okay.
I get to pick her brain and listen to her about the things that she's fighting on the front lines, as far as healthcare in general, prescription, drug prices and things of that nature. And so, I think one of the my all of this comes back to a set of bills that I've written as part of the green agenda. So, and I've tried to encompass several, there's so many things. Somebody asked me not long ago, I hate to spin off here, what is my one main thing that I want to fix? And my brain just spun out of control because there's so many things broken.
Yeah.
I just couldn't focus in on one thing. So, but uh, our healthcare is number one, and of course our drug prices. Why is it that the all the developed nations on the planet pay less than we do for the same exact drugs from the same makers,
Hmm.
right? And so to me, that was the biggest question. And so I started looking into that and uh, I'm trying to find these pharmacy benefit managers, I think is what they're called. And
Hmm.
and if those folks are negotiating prices, why aren't those savings passed on to the customer? To the patient. Why? So, you know, that so they're really there to save money so that the makers, the corporations can
Yeah.
make more profit, and it's ridiculous. So, and I think, like I said earlier, everything's connected, and if you look at this, we could talk about housing, our homeless problem. All of this is connected, and it's all about corporate greed, and improving the bottom line, if you will.
Mhm.
So,
Yeah.
yes, I mean, through some of my bills, the Freedom to Thrive Act, really focuses in on rural communities. I think that our rural communities suffer first, especially when it comes to healthcare, public education, a whole lot of things. But my Freedom to Thrive Act really focuses in on that, and where we can, you know, uh, how do we, get our drug prices down, expand Medicare and Medicaid to help them to help patients with their costs.
Mhm.
Uh, the big beautiful bill that they call it, which is going to hit after the midterm, and I think that it's going to exacerbate the problems that we're talking about now.
Mhm.
Uh, it's going to get way worse.
Yeah. No, definitely, and that is, I think, a concern for a lot of folks, not just in physicians or providers, but also just the people. And I think that's something that we really have to prepare for, and especially the forecast is rural areas, specifically rural hospitals, will be hit hard by some of the provisions of the big beautiful bill. Kind of moving on to, you earlier talked about mental health. And as you know, Oklahoma faces significant behavioral health and substance use challenges. What specific, like federal investments or state federal partnerships, will you push to help improve access to crisis services and inpatient mental health capacity treatments?
So, I mean, Oklahoma, and I'm sure many other states are as well, really struggle with addiction. Addiction is so prevalent here, and I dealt with it a lot. Years back when I was still in law enforcement, again, this all connected. It's connected to our economy, and if people are struggling. Homelessness and our, mental health is just a huge part of that. My situation, for example, I aged out of foster care straight into homelessness.
Hmm.
Now, I could have fallen into those same traps, into a life of crime and drugs and things of that nature. So all of that is connected, but we really need, a major expansion of, certified community behavioral health,
Hmm.
right? And this, and most certainly out in our rural areas too, right?
Hmm.
So from the world that I live and work in, a lot of this starts in rural communities because there aren't the services. And if you're homeless or if you're in a crisis and you're starting to run out of places to go, people to go to for help, you end up in a bigger city looking for resources,
Hmm.
right?
Yeah.
So if we could, if we can expand things out into our rural communities, it's going to help a lot and certainly take some of the pressures off of, the bigger cities,
Hmm.
the resources that are stretched thin there because everybody's coming in.
Hmm.
Uh, but again, we spend so we spend so much money and time in this country, throwing money at the damage, right, of
Yeah.
broken systems instead of the prevention, and
Yeah.
it's ludicrous.
Yeah. No, definitely. And I agree. I think we really have to focus as a system, as a nation, on prevention, on finding ways to, in order to mitigate the damage that like you said, has been, in order to mitigate it and to prevent it even before it gets to that point. And of
Mhm.
course, that's going to take time and investment. But that's why we have people like you to fight for us. One of the other things that we're really worried here in Oklahoma is the lack of maternal health care access, and of course, some degree of reproductive services. And this isn't just a matter of being seen in clinic, but when you're looking at the lack of access to postpartum services, telehealth, and family planning, how would you ensure we could still provide their services while respecting federal protections?
So, look, I support any service um, that protects women and their health care.
Hmm.
It's not for me to decide, right, what that health care should be, right?
Yes.
No one is in the doctor's office with me making decisions about, you know, making decisions for me between me and my doctor. Why is this happening between women and their physicians and their
Hmm.
doctor? Again, that's something that is ludicrous to me. And just my opinion is, what my doctor and I talk about is no one else's business, and it's the same for a woman and her doctor. But
Yeah.
definitely, uh, uh, we need we need to any reproductive health care under federal law needs to be protected 100%.
Hmm.
That includes for me contraceptives, family planning. Again, this is all connected. Back to my situation. If if we want to bring the A word into this abortion, right? Well, people. I understand people's opinions about abortion, but we want children born. We want to protect and have these children born. But what happens to them when they're born into a situation like mine where they just aren't wanted?
Hmm.
And so, again, now we've created actually a burden. It's in many cases. Again, had I just gone a completely different path, rather than us sitting here, your taxes would be paying to take care of me while I sit in prison or through wraparound services, right? Trips in and out of jail or the ER. Maybe I'm homeless. Uh, so again, if we're going to, I've kind of spun off here, but to me, it's all connected, and I can't help it. And
Yeah.
if we don't protect our women, if we don't protect women's and their healthcare rights, and then protect them long-term care afterwards, and the child that's included,
Hmm.
right? Then we're just always throwing money at the problem
Yeah.
instead of the prevention. So, uh, we need a 12-month in my opinion, we need a 12-month postpartum, Medicaid, uh, coverage of some kind. Even through, telehealth, right? Any kind of service. For a lot of women, you know this better than I do, postpartum health uh, is is a huge thing and very important, very extremely important. It's
Hmm.
things aren't over for a woman after the baby's born.
Yeah.
You know? And
Yeah.
heaven forbid if she should lose that pregnancy, what services are there for her, you know?
Yeah.
And that's important too.
Hmm. No, definitely. And postpartum care is something that Oklahoma is really lagging behind. Of course,
Mhm.
I don't like saying this, but we're not really well known for being in the top 10 in a whole lot of these healthcare categories. We often, in the bottom 10, or actually, unfortunately, bottom fifth, if we're really going to be honest. And we do need to do something about that as a state. And if people can say, well, this is not a priority, well, we need to take care of this and that. I get that, but at the end of the day, when you're not taking care of our mothers and our kids, you don't really have a future, right? And that's something that I think is we can all agree on is we have to take care of our children, we have to take care of our mothers, and that's how you build, a strong society and a strong foundation.
To me, it's number 1. Number 1.
Exactly. One of the things that I find very admirable about you, just given where things have been in our country in the last 2 years, specifically, I know with the Epstein list and this now increased awareness about human sex trafficking. And what I don't think many Oklahomans understand is how prevalent that is here in Oklahoma. But you have already been fighting in the trenches for a long time regarding this issue. This wasn't something that just started for you just, a year or two ago. You've been doing this way longer with your organization, Safe Haven, Oklahoma. And your platform also highlights significant anti-trafficking work. Which of federal statutes or interagency reforms will you prioritize to strengthen, again, prevention of sex trafficking and also victim identification and long-term care for survivors of sex trafficking?
Well, we need a stronger enforcement of there are a lot of things in place, right, that just aren't being utilized, and we need a stronger enforcement of the, Trafficking Victims Protection Act, for one.
Mhm.
So, uh, the the sad reality is, and you just touched on it, is that people don't realize, and I've been screaming for years, and that this affects every community in our nation, no
Mhm.
matter how small.
Yeah.
They think that the small towns are protected from this, and they aren't. So, um, predators don't always hide in the big city. Sometimes they hide in plain sight. Sometimes they're, the pillar of the community, you
Mhm.
know, and that's how they cover their tracks. But enough isn't being done on the federal level, and like I said, there are forces in place to address these issues, but it's we just are it's not being utilized, right? Especially right now, especially with this current administration. But there are things that I could talk about right now that would
Mhm.
just sound conspiratorial because people aren't experiencing it firsthand, and so to even though it's true, I can tell it, and it just sounds ludicrous because it so seems so far fetched. But again, it's the truth, and this whole human trafficking thing is one big giant global connection,
Hmm.
right? Its tentacles spread across the globe and even into smaller communities. So now, again, on the federal level, and I think some of this is going to connect to our foster care system because in recent years, um, kids are being trafficked out of foster homes.
Hmm.
So they're coming out of a bad situation and they're put into, people's care who are supposed to help and nurture, and help them heal, and they end up being trafficked out, which people just don't. Well, I've said this before, and people are shocked by it. They just can't believe it's happening, and it
Hmm.
is happening. So again, uh, we need to look at we need to look at the there's a it's a supply and demand problem, sadly, and there's such a demand, which is sad to say that that there's often a supply problem. So
Mhm.
we need to focus on that. We need to focus on how do we protect our kids, and how do we go after the networks,
Mhm.
that are perpetuating this vicious cycle.
Yeah.
Our reporting, our federal reporting for missing children and is 48 hours.
Yeah.
Why is it so long?
Mhm.
When I was snatched up as a kid in 48 hours, I was already in California. So
Yeah.
that's a long time, so that needs to be shortened,
Mhm.
and I can't wait to get in there and look at the federal resources that we have with this and,
Mhm.
see how they can be expanded. How can we just utilize them, you
Yeah.
know?
Yeah.
Uh, it's an out of sight, out of mind problem, sadly, and if we don't people don't want to think about it.
Mhm.
They don't wanna hear about it. It's very hard to raise money for Safe Haven because it's a conversation that people just don't wanna have,
Yeah. Yeah.
you know? And it could be right next door, and it's just so grotesque that people don't wanna envision it, so
Oh, I completely agree. I live in in Edmond. I was raised there, and
mhm,
when I went to Edmond Memorial High School, and sometimes you hear stories of these operations that get done on these
yeah,
nice suburban homes, and lo and
mhm,
behold, and then you find out the horrible truth about sex trafficking. And you're right, it's not some random place in the middle of nowhere. It's not some place in the middle of the urban area. It could be just a quiet, nice, looking good home in the middle of suburban America, and you'll be surprised. And I think that's really the heartbreaking aspect of sex trafficking here today.
mhm,
Uh, Mr. Green, thank you so much for everything you've done with Safe Haven, but also for taking the chance and running to be our next senator. We really appreciate you coming on board, answering our questions. Would love to have you on in the future again, of course.
yeah, that'd be
Uh,
great.
and maybe ask senator. Who knows? Yeah,
That'd be
we,
great, yes, sir.
we really wish you the best. And once again, to all of our listeners, this is Connected by Health. Thank you so much for taking your time and listening to us. We've had Mr. Troy Green, who is running to be the next senator of Oklahoma. And remember, we're all connected by health, and we'll see you later.